Our next presenter is very interesting, Dr. Prasanna Venkatesh Ramesh, and topic is virtual reality, ophthalmic, ocular, metaverse, the novel 4D cost-effective holographic ophthalmic AI metaverse with augmented reality.
Thank you, AOS, for this wonderful opportunity. So I'm going to take you into a module of teaching, counseling, and surgical simulations that I have made at my center in Trichy, Tamil Nadu. So we all would have seen movies like these, Iron Man with holograms, and a lot of science fiction, right? So these were some of my inspiration, which led me to make something similar in ophthalmology for the purpose of teaching, counseling, as well as for diagnostics. So this is my patent protected innovation, and these are the 6 modules that I'll be covering each in a minute. So for me, ophthalmology was an imaging based field that we all know. To understand the subject, can we really make images moving in terms of animations? You can see a iris process on your left, and then you can see a peripheral anterior synechia on the right. So I show animations like this where an iris process is more of fine strands, whereas in PAS you can see more of broad basal tissue of iris, right? And then when you take them into a real-time scenario where how an iris process is more fine and arborized, which doesn't cause any occlusion to the angles nor cause rise in IOP. Whereas on the right-hand side, the PAS is more broad-based, it adheres with the angle and also causes rise in IOP. So this is what I really started understanding in conveying the concepts better. Can we convey it through videos? Again, this is one of my animations of a pupillary block. You can see it's only a 10-second animation. So if we are going to teach, why do we do YAG-PA, right? For a neophyte, we tell them that the cause happens here and the effect happens here. So because the posterior iris is in contact with the anterior lens or the pupillary block that we call here, the aqueous is not able to come through this, which has to go through this, and that is why it pushes and the effect happens here. So that's why we do a PA here to bypass the system. So these are simple animations that I started making to convey complex concepts simple. So again, this is another 1-minute video of whole glaucoma in a minute. Can we really show it to an undergraduate or a first year postgraduate? You can see again, this is one of my fundus pictures. For the first 10 seconds, I'm showing what is the increased vertical cup disc ratio. Then we are slightly zooming in the video and showing how the notch is present and the bionetting sign, slowly taking them into higher concepts like basic sciences. ISNT rule is breached because of the notch. There is inferior thinning of the neuroretinal rim. Coming out and then showing the RNFL defect, pulling this picture down, taking the patient's own visual field, showing the superior arcuate scotoma, reducing the transparency of the fundus photo and keeping the OCT on top and showing the ganglion cell layer as well as the RNFL damage. So you saw how many points we are able to convey when we teach concepts in a video based manner, right? And I also publish my work, so you can find these publications in IJO as well as other journals. Again, complex scenarios like ALT versus SLT. See the spot size difference between ALT and SLT and where it is given. Always make sure you orient it anatomically. So I first show the anatomy and then show it is between the pigment and non-pigmented trabecular meshwork that we place the spot. Another dying concept of argon laser peripheral iridoplasty. So these are all concepts that we learn a lot of theory. Showing a normal angle and then showing what is an oppositional angle and then showing how a simple laser can actually open up an oppositional angle called argon laser peripheral iridoplasty from a cross section angle. Can we show this from a front on view? Yes. Again, this is another animation. All the animations here shown are made by me. You can see again 24 spots are placed in 360 degrees. Can we show another angle of ALPI? Yes, we can show the gonioscopy as well. See how the spot is given and how the iris actually retracts the oppositional angle from the closed chambers. Again, these are all videos of mine in my YouTube channel, which goes in my name only. You can, for the love of teaching, we have made many videos. Again, a simple cataract surgery. See how the root of iris or the iris falls back. How the ciliary body falls back post cataract surgery. How the scleral spur also slightly falls back. And even how a peripheral anterior synechia can actually break when you do a simple phacoemulsification. So then we started creating a lot of unanimated models into 3D. So first it started with animation, then it went into 3D model making where circle of Willis, cavernous sinus and the eyeball was created. And once these 3D models were created, you can see I gave it in a smartphone where you can click by the button and you can go and access angle or if you want to go and see the fundus, you can choose whether you want to enter a anterior segment or a posterior segment. So this was the second innovation called the unanimations, where again confocal images were used for autofluorescence, infrared. You can see the collections: fibrovascular band, retinitis pigmentosa, RNFL defect, myelinated nerve fibers. So moving from unanimations to animations, this was the next level of evolving, and you can find this publication as well. Then came in the real 3D innovation, where the holograms was created in the smartphone. On the left hand side you can see that it seems as if he's moving through thin air, but on the right hand side is the view that you can see in the camera, that we are accelerating the learning for MLOPs or undergraduates or even for first year postgraduates. You can see the exact retina for what a retina surgeon will see in real time on day one of the curriculum, when you are trying to teach complex concepts, even undetectable structures like a circle of Willis, cavernous sinus, which we never really have seen it in 3 dimensions, right? So we sat with the anatomy of Cunningham's, Chaurasia, did all the 3D recreation, and again for YARC PA counseling, showing the angle. Again, this is an NTG patient where a color fundus, and this is an RNFL defect, everything in 3D. So this is also published and validated. And then came the holographic 4D, where you can actually touch this with the headset that we innovated. You can actually move it. On the right hand side, it will look as if he's moving through thin air, but he's actually moving through the structures, and a whole museum of this has been created at our center. I have not brought it here for logistical issues, but this is the future where even examination can be done in EMR, in 4D, and even the OCT filters that you can actually see. It's a very promising time, my dear friends. Ophthalmology is an imaging field, and we have also created the whole neuro-ophthalmic imaging itself, which we always tend to mug up, right? But can we have something to really have this kind of a aura or a museum armamentarium, which helps us in getting the complete concepts of innovative learning? And this is my daughter's picture. Again, the Gen Z kids, as we were all talking about, give or take, they are into technology. So technology is here to stay after COVID, and these kind of technologies are being there. I think we need to make sure we use it for the right purpose, so that we tend to pass on the much better tools forward. I'm just summarizing it. So this is the flow chart. If a patient, again for diagnostic purpose, enters into our hospital, you can see again we are also adding the OCT filters into the fundus as well. So this is something that is evolving and very much into the armamentarium. And to summarize again, I'm just showing this one particular slide, the simulations that we have made before I close it. So this has a role in surgical simulations as well. You can see again any surgery. Currently we have cracked the code for MIGS, minimally invasive glaucoma surgery, because that cannot be done on a human eye or even for a cadaveric eye, because the angles really don't be there. So this is one of the models that we created to practice at your place. You can sit, put these headsets, and you can actually practice these kind of innovative mixed surgeries. And then last is the puzzles that we made. I think ophthalmology is a very beautiful field. It's an imaging field, and we are trying to create the 6 dimensions, or it may be even more, called the Ophthalmic Metaverse. Once again, thanks AIOS for this opportunity to share this on teaching, counseling, diagnostics and simulations. Thank you.
Thank you, Dr. Prasanna, for very nice presentation. And AI is future, and I think it will greatly help to all ophthalmologists. And your videos are freely available on YouTube?
Yes, sir. My channel is open access, sir.
Okay.
And my applications are also free only, sir. It's not cost.
It will help greatly in counseling.
Yes, sir. Thank you, sir. Thank you.